Hunter syndrome is a rare genetic condition that affects 1 in 162,000 live births. The rarity of this condition can cause there to be a long journey between the appearance of symptoms and families receiving a conclusive diagnosis. This means when families reach the end point of this journey, they can be faced with a range of unpredictable emotions. In this part of our Hunter Syndrome Journey series, we'll take a deeper look into the emotions that receiving a Hunter syndrome diagnosis can cause families, and in particular caregivers, to experience. These can range from shock and disbelief to relief and hopefulness. The fact that Hunter syndrome is such a rare disease also means that families can feel less prepared to receive a diagnosis than they may have felt for a more common, well-known condition. One of the most common responses to receiving a diagnosis is relief. Caregivers often feel a weight lifted off their shoulders once they've finally found an answer to the questions raised by unexplained symptoms and multiple visits to the doctor. However, this feeling can be bittersweet, as the relief is still tinged with sadness as families consider the road ahead and the challenges they have yet to face.
And the doctor looked at us and said, "I know what your son has. He has something called Hunter syndrome, otherwise known as MPS II.
And your reaction at that moment?
I was happy that I had a diagnosis.
I was thinking that.
I was devastated to know that my son would suffer for a while with many different ailments, but the road is a long road.
Another frequent emotion that families can experience after hearing a loved one has Hunter syndrome is shock, or the feeling that their whole life has been turned upside down. This is not an unexpected response, as Hunter syndrome can affect every area of both the patient's and their caregivers' lives. Due to the rare incidence of Hunter syndrome, it is also understandable for families to experience shock, as they may have not even heard of Hunter syndrome prior to receiving a diagnosis.
And she said that both the boys have something called MPS II, also known as Hunter syndrome. It was difficult. It was difficult to hear. I thought to myself, she's wrong. She doesn't know what she's talking about. But then we went home and I researched everything, and all the pictures I saw of all the boys that have it, they were my boys.
Another understandable response in the situation is disbelief or even denial, which can be related to or follow on from feelings of shock. Upon hearing a Hunter syndrome diagnosis, it may be hard for caregivers to line up this new information with how they pictured their child's future. This can be an especially potent feeling, as Hunter syndrome is not typically noticeable at birth, so finding out that something has developed since then can be difficult to come to terms with.
It is even harder if you've got a healthy child, and then 2 weeks or just before Christmas, and he is nearly 2 years old, they tell you you've got a really, really ill child.
Sometimes during the long road to diagnosis, families will have had the opportunity to do deeper research into the possibility that their child has Hunter syndrome. They may even already be aware of a family history of the condition. In these cases, upon hearing a confirmed diagnosis, they may feel better prepared for the outcomes and take a more optimistic, hopeful approach. They may also feel comforted by their existing knowledge of the condition and better able to face the road ahead as a result.
Well, I think I was in shock for a little while and felt badly about that. But then I knew he'd be all right. It's been in our family, and I loved my uncle who had Hunter syndrome and dearly loved my brother who has Hunter syndrome. So I knew it would be fine. Well, I've always had hope because I knew from my family's history that there's so much love and so much more to life than just the identity of having a rare disease.
Regardless of how individual families feel when receiving a Hunter syndrome diagnosis, One thing they all need at this time is support from their communities and loved ones. The best way to provide this is by raising awareness of Hunter syndrome, both to help families already diagnosed to feel less isolated in their situation and to help those yet to receive a diagnosis to feel as prepared as possible. If you or someone you know is coming to terms with a Hunter syndrome diagnosis, there are various resources and organizations available to help. Open discussions with loved ones, family counseling, joining a patient organization such as the National MPS Society, or in-person and online support groups are just a few things that could help during this stage of the journey. It is also important to remember to do things as simple as asking for help when you need it and taking time to enjoy the daily moments with your children and the love they bring to your life. Visit hunterpatients.com today to learn more and help those on this journey. Talk to your doctor if you're concerned about symptoms or have any other questions about Hunter syndrome.